All right.
All right, and we are live.
All right. Good evening, everyone, and welcome to the session. Today we have someone a little special today. We have Dr. Ariana Kelly, and she's here to talk about her journey as a dental anesthesiologist resident.
Yes, thank you so much for having me. I'm really excited to be here. So I am Dr. Ariana Kelly. So I am a first-year resident at the University of Pittsburgh. I'm a resident in dental anesthesiology. So I'm going to kind of just start with a little bit about me, kind of how I came to this specialty, and then just a little bit about dental anesthesiology as a specialty. If you're entering dental school, if you're in dental school, kind of wanting to learn more. Things to do in dental school if you're interested in dental anesthesia, applying to the residency programs, dental anesthesia, like what it looks like in private practice, and then any questions and answers you may have for the end here. Okay, so a little bit about me. So first, I went to the University of Pittsburgh for undergrad, which is in Pittsburgh, Pennsylvania. I majored in nutrition and dietetics, and I minored in chemistry. And then I liked it so much, I stayed for dental school. And some of the reasons why I chose Pitt for dental school was just because I really liked that on my interview day and just from hearing from other classmates that there was a very strong family-like environment between the faculty and the staff and the students and the residents too. So that was something that really drew my attention for sure for Pitt. I really also like that it was a small class size of 80 students per class. Once you are in your third and fourth year, you do get around 8 what we call advanced standing students, which are students that maybe got a dental degree in a different country. And then they're coming to the United States to do 2 years of dental school in the United States to get a license in the United States. So it ends up being around 85, 87, depending on the class that year. I really like that every single specialty program was represented in our school. We have a clinic for every program except maybe oral facial pain because that's a little bit newer. But we have every other specialty other than that. And then you get a lot of exposure to all those specialties and specialists in the area. I also really liked how Pitt had a lot of scholarship opportunities. So a large percentage of our class got scholarships upon acceptance, which was really nice because that really helps to make your decision when you're trying to decide where to go for dental school. And then I liked it even more that I stayed for residency. So I'm still at Pitt for dental anesthesia. And I jokingly call myself a triple panther because we're the Pittsburgh Panthers. So I've been here for a really long time. But the reason that I chose Pitt for anesthesia residency was it's the oldest program in the country. And it was the first program ever to be founded in the country. Our founder, Dr. Leonard Monheim, who I will discuss a little bit later, he was really kind of fundamental in funding our program, getting us funding through the hospital. So it's nice that we are paid as opposed to paying tuition. It's really the only program affiliated with a dental school. I know Ohio State has technically a dental school associated with their program. However, we are in the first year of our residency program. We're typically in the school. We interact with dental students. So it's really, really nice. As a dental student, I was able to kind of see all of that. We also have a strong emphasis on ambulatory anesthesia, and I'll talk about that a little bit later. So ambulatory anesthesia, if you're unfamiliar, is just basically when you go to for example, a hospital, and you are getting a procedure done, you will go into the hospital if you're getting a liver transplant, for example. You'll be admitted to the hospital. You will get your procedure done and you'll likely stay in the hospital monitored. Ambulatory anesthesia is kind of similar. If you've ever gotten your wisdom teeth taken out, you go to the office that day, you get sedated, take your wisdom teeth out, and then you can go on your way. There's no real admittance to the hospital. So just a couple things about dental anesthesiology and its history. So dentists were actually the first people to successfully perform anesthesia per pain control during surgical procedures. And this was done on October 16th, 1864, which is known as World Anesthesia Day. So much to medical doctors' demise, dentists were actually the first people to use anesthesia. I talked about Dr. Leonard Monheim before. He was the dentist that started the first program, the first dental anesthesiology program at Pitt in 1949. And it's been around ever since. And, oops, I'm sorry if my screen is not sharing well. Hold on one second. All right, let's get back into this. Okay, so he was the first one to start the program. He was also a founding member of ASDA, which is the not American Student Dental Association, but American Society of Dentists Anesthesiologists. And so it's a program where as a dentist anesthesiologist, you can go to national meetings and learn about current events. So he was one of the founding members of those. We officially became a specialty in 2019, which is kind of crazy because we've been around since 1949. There have been multiple failed attempts to become a specialty, just political things, other people wanting to do sedation and dentistry. They didn't necessarily know how well we would do as a specialty, but finally in March of 2019, we became an official specialty. So some reasons why I think dental anesthesiology is super important is that dentist anesthesiologists are needed so much. So these numbers are a little bit outdated, but they're pretty accurate in that it shows the number of dentist anesthesiologists in North America, so including Canada and the different states. So you can see that dentist anesthesiologists are very heavily covered on the coasts, kind of in Texas, in Arizona, on the East and West Coast, but not really in the Midwest. And so that's where there's a huge need for dentist anesthesiologists. So when people talk about job security, I kind of always reference them back to this infographic that there are places in the United States that have 1, 2, 3, 4, or no dentist anesthesiologists. And this is a very good specialty to get into, especially now. Each year, it's just growing more and more. So if you're interested in doing dental anesthesia, there is certain things you can do while you're in dental school or even before dental school to kind of better your application. So first and foremost, the most important thing is shadowing dentist anesthesiologists in your area. However, I know it can be hard if you live in maybe the Midwest that doesn't have a lot of dentist anesthesiologists. So there's other things you can do. A lot of the times oral surgeons or even pediatric dentists will run sedations for their patients if there's no dentist anesthesiologist. You could always shadow an MD anesthesiologist in a hospital or a CRNA, a certified registered nurse anesthetist, because sometimes in the Midwest, CRNAs will go to offices kind of like we do, like pediatric offices, dental offices, and run sedation for them. Some of the things you can do, you can extern at programs. So there are 8 programs in the country, and I believe 1 in Canada. So first, the University of Pittsburgh in Pittsburgh, Pennsylvania. There's NYU Langone in Brooklyn, Jacobi Medical Center in the Bronx, New York, Stony Brook University Hospital in Stony Brook, New York, Ohio State University in Columbus, Ohio, Illinois Masonic in Chicago, Illinois, St. Barnabas Hospital in the Bronx, and Wyckoff Heights Medical Center in Brooklyn, New York. So you can see a lot of them are based in New York, 1 in Pittsburgh, 1 in Ohio, and 1 in Chicago. And the reason I have an asterisk by these 2 on the bottom here is just because it's harder to apply right out of dental school for those programs just because they require you to have some experience or a 1-year general practice residency prior to applying. I don't know if that's going to change in the future, if that's still it, but as of last year when I applied, that was kind of the requirement for them. Another great thing to do is to contact a current resident and ask questions about their experience, talk to residents like me, people at different programs, kind of how they like it, what they wish they would have known before starting, things like that. And take extra anesthesia or medical emergency courses at your school. So some schools offer these, some dental schools offer them. You can even do things like take basic life support, CPR, or you can take advanced cardiac life support where you learn kind of how to do more. So those are just different things you can learn to set yourself apart when you're thinking about applying. So how you apply is kind of similar to how you apply to dental school. So it's through the ADIA website, and it's called ADIA Pass. So similar to medical school and how they do their residency matching program, we use a match system. It's the national matching service. So all anesthesia programs use this. So basically what happens is you will apply to programs, you'll interview at programs, and then you'll rank your programs 1 to say 8 if you applied to all programs, got interviews at all programs, in the order of like your top to your least favorite. Programs will then rank all the applicants in a similar manner from their favorite to their least. And then the algorithm will match you to your top choices. If they match together, if not, you'll go to your next one, kind of things like that. There's really great videos on it and how the algorithm works that explain it way better than I am right now. But typically there's 2 phases of match. So match phase 1 is where anesthesia is included, and that's at the end of November, right before Thanksgiving. And then phase 2 is sometime in January. That's a couple other specialties. So typically the deadline is in September, October for your applications. And then interviews will be in October or early November. And then, like I said, match day is at the end of November. So things you can do to kind of prepare your application. First and foremost, you can prepare your GPA and class rank, try to get those really as high as you can get them while doing well. I know some schools are pass fail. Some schools don't have class rank. So it kind of just depends on how your school falls. But if you do have a GPA and class rank, just always try to, do well in school, keep your grades up. Shadowing, like I mentioned, is really beneficial because, you could get letters of recommendation from dentist anesthesiologists you shadow. And the DA world is very small. And so chances are you're going to get a letter from someone that a program director maybe knows, or someone at the program that you're applying to knows. And so that's very beneficial. Again, like I said, extern at the hospitals that you're interested in the programs, they typically offer week-long externships where you basically just shadow the residents and they kind of get to know you that way. Really prepare a nice personal statement that's kind of unique to you. Create a CV or a resume. And then, like I said, get letters of recommendation from dentist anesthesiologists or MD anesthesiologists, or maybe like pediatric dentists or oral surgeons that you've shadowed that run sedations. And then you'll need to submit your board scores from dental school, your DAT scores, and a headshot. And then prepare for interviews and practice. So I really always say interviews can make or break you. So if you have if you don't think your application is all that great, but you really interview well, they can really, really like you, and vice versa. If you have a great application, but you might not interview well, maybe they won't consider you as highly. So I always say practice. I always thought that I was great at interviews. I just thought it was easy. I can talk to people, all that good stuff. But it's definitely really important to practice, because when you get someone else's perspective, you can see what you're saying that maybe sounds weird, or maybe they can critique you on if you're speaking too quickly or things like that. Or if you don't have someone you can practice with, you can always just record yourself. I've done that before. And then you can realize maybe I don't want to say that, or maybe I, don't want to do this. So that's definitely beneficial as well. So before starting residency, if you do match in a dentist anesthesiologist program, so what you can do is you want to have a solid understanding of the following. So pharmacology, physiology, biochemistry, anatomy, and especially medical emergencies. So in your dental school curriculum, you might have gotten these great. Some dental schools hit these heavier than others. It kind of just depends on where you go. Some dental schools are more clinically driven. So you might be playing catch up in certain areas, but really try to hone these in. Some resources, some textbooks. There's one called Clinical Anesthesiology by Morgan and McHale. That's a good one. And then Miller's Basics of Anesthesia. So these books are really, if you're kind of already in residency, I would say, because I've tried to read these before. And even sometimes when I do read them, they're a little bit dense. So just like any textbook. So they're kind of hard to read. But there's also other really great resources that are free. So videos on YouTube. For example, the University of Kentucky has a really great anesthesia, channel where they go over different topics of anesthesia. And then there's another podcast that I really like listening to. It's called Anesthesia and Critical Care Review and Commentary, or ACRAC for short. The doctor there is an anesthesiologist at Johns Hopkins, and he does a really good way of kind of slowing down topics and going over them in a very digestible manner. So I really like listening to that when I'm cleaning or driving or things like that. So if you just want to kind of get involved, that's a good podcast to get into. All right. So to talk a little bit about kind of the practice of dental anesthesia. So dentist anesthesiologists are all over the USA, like I showed that infographic before. They're mostly concentrated on the coasts, however. So like I said, there's more needed in the Midwest, more rural areas, especially where there's not a lot of specialists, even some in the South area like Florida and on the southern border as well. So there's 4 main practice models that pretty much all DAs fit into. So there's the surgery center model, there's mobile anesthesia, there is the operator-anesthetist model, and then there's academia. So I'll go over these in detail, kind of a typical day for all 4 of those. But when you're looking for a job, you kind of want to figure out first what practice model you want to fit into. So some dentist anesthesiologists work in surgery centers, some do their own, some do general dentistry or any dentistry while, doing the anesthesia, and then some go straight from residency into, teaching in a residency program or at a hospital. So it kind of just depends where you want to go. In addition, you want to think about the populations you want to treat. So a lot of DAs will treat patients that have high anxiety, pediatric patients, special needs patients. So those are some things like if you really want to treat, patients with special healthcare needs or kids, there's different, areas you can fit into. Also, you want to know how experienced the treating doctors and the assistants are. So have they ever treated sedated patients before? Have they ever, as a dentist, seen in an office someone be intubated for a case? Have they ever, helped with induction of anesthesia? Do they know how to manage a patient's airway? How well are they trained on medical emergencies? So that will kind of really make or break your where you want to work and which offices you want to kind of go to, because if you have that help and they're very skilled, that kind of takes a lot of the worry off of your shoulders if you're alone in a practice. So that's definitely helpful if the assistants, are trained in that, if the treating doctor is trained in that. Will you have assistants to help you, or will you be on your own? So some DAs will hire a trained assistant or a nurse to kind of help them start IVs, go into practices with them, pre-op patients, do calls. So that's something to consider as well. And then which depth of anesthesia will you be providing? So basically a depth of anesthesia, when I say that, I mean, so will the patient be awake and alert, but kind of just more relaxed and comfortable, or will they be fully unconscious and you will be breathing for them? So more of from a minimal to moderate sedation all the way to a general anesthetic. So that's something you want to consider as well. All right. So a typical day in a surgery center, kind of how it will, run is the day before, you will call all of your patients and give them pre-op instructions for the sedation portion of the appointment. So some big things you want to talk about are the NPO requirements. So they can have nothing to eat or drink up to, let me think about this, 6 hours before. They can have clear liquids up to 2 hours before. So when we say clear liquids, we mean things like water, Gatorade, apple juice. Any liquid you can kind of see through is considered a clear liquid. So you want to give them the proper NPO requirements, because that is very important. If they have eaten anything, you can't go through with the sedation. You also want to make sure that they have an escort, someone that can take them to the appointment and take them home, someone that can monitor them the rest of the day, because they will be pretty drowsy following treatment. And just other little things, make sure you don't have any jewelry on, make sure you're wearing comfortable clothing. If it's a female, maybe ask, not to be wearing acrylic nails or long fingernails, because sometimes that can interact with our monitors. So you'll call them before, give them all the pre-op instructions to either them, if it's a pediatric patient, their, parent, or if it's a patient with special healthcare needs, maybe their caregiver or their care facility or someone that's going to bring them to the appointment. So you would ask them to you would arrive at the surgery center, and with a surgery center, it's nice because it's just typically one location. And so what you'll do is you'll go to your surgery center, you'll set up all your operatories, you'll pull up your drugs for the case, your emergency drugs, and any emergency airways you would need. You would do all your checks of all your kind of tools that are with you to make sure they're functioning properly in the event of emergency. And then once the patient arrives, you'll do your pre-op interview with the patient and the escort, kind of going over how you'll get started, what the plan is for them, and then instructions for after anesthesia. And this is a good time to also coordinate with your treating doctor. So if it's an oral surgeon, you want to make sure your post-op instructions kind of line up so that they're not hearing conflicting things. And then you want to consider how you want to induce the patient. So meaning how you want them to go under anesthesia. So there's three main routes. There is IM, or intramuscular. That's typically like a shot in the arm. That'll make you sleepy. And then you can, start an IV and go from there. There's IV induction, typically with adults or more cooperative older children. You can start an IV and then just give the medications through there. And then there's inhalation induction, which is a mask that has kind of gas in there. It'll get them sleepy, and then you can start an IV and go from there. So then with a surgery center, you'll run your cases, typically 4 to 6 cases, depending on your schedule, depending on your comfort level, and the treating doctor and kind of what their treatment plan is for the different patients for the day. And they'll either be intubated, meaning there will be an endotracheal tube, either through their nose or through their mouth down into their lungs that secures their airway for them, or we call open airway, which means they'll be breathing on their own, spontaneously breathing, and we'll just be giving them supplemental oxygen through a nasal cannula. And then the patient following treatment will kind of go to the PACU to recover. The PACU stands for post-anesthetic care unit. And sometimes surgery centers will come with a trained assistant or a PACU RN while you kind of start another case. Sometimes you're the one that has to recover them. It kind of just depends on where you're set up. And then you can give them, or a PACU RN or assistant can give them, post-op instructions, especially to their escort, because they'll probably still be kind of groggy. And then you can dismiss the patient. So this is, again, ambulatory anesthesia. They're going home afterwards. A typical day with mobile anesthesia. So the difference here is that with mobile anesthesia, you're going to a different office every single day. So maybe on Monday, you're going to go to a pediatric dental office. Tuesday, you're going to go to a periodontist's office. Wednesday, you're going to go to an oral surgeon. So it's kind of different each day. And you kind of have to bring all your stuff with you around. Whereas at the surgery center, like it would be at a regular dental office, you're kind of just sitting there with all of your stuff. And it's already there. So again, you would call your patients and give your pre-op instructions, again, MPO requirements, escorts, etc. You would arrive at the dental office for the day that you'll be working at, and then you'll have all your stuff in tow. You'll set up your operatory, again, pull up your drugs, your emergency drugs. You'll pre-op the interview. You'll kind of decide how you want to induce. Typically, when you're doing mobile anesthesia, you're more likely to do intubated, open airway cases, because with an intubated, sometimes you need a ventilator if they're not spontaneously ventilating. And so obviously that's very difficult to lug around a giant anesthesia machine. So if you're going from office to office, you typically will do open airway, and you can run a little bit more cases just because patients wake up a little bit quicker than when they're intubated. So there's less turnover, or there's a greater rate of turnover of your patients. And then you'll recover the patient, or someone that you have, maybe an assistant, will recover the patient and give the instructions, and then they will dismiss them. And then the next day you'll go to a different office and kind of do it all again. So the third model is an operator-anesthetist model. So there's like a little bit of like conflicting, I guess, opinions on operator-anesthetist. Some question the safety of it, and some kind of think it's okay to do given the right circumstances. So with an operator anesthetist, you are able to do the dentistry while also, doing the anesthesia. However, you should have either trained assistants or nurses in your office that are able to watch the monitors for you, make sure the patient's vitals are stable. So again, similar to all, you will call your patients, give them the pre-op instructions. You'll arrive at your office because it'll just be your practice. And then you'll go over all of your medical emergencies with your assistants or your RNs, whoever that you have there, just so in the event that something's going wrong and you're working on the dentistry, you have time to, they kind of know what to do. You pre-op with the patient, you'll go over how you're going to start the case, again, the induction, and then you'll run your cases, again, 4 to 6 around. It kind of depends. Some if they're quicker cases, they can go, 4 to 10, 4 to 12, things like that. Again, intubated or open airway. And like I said, you do the dentistry while a trained assistant or an RN can watch the monitor, and under your direction, give drugs as needed. And then you'll recover the patient, again, give the post-op instructions and dismiss them once they're fully recovered. So a typical day in academia is you would arrive at the institution, whether it be a dental school or a hospital, and kind of review the cases for the day with the other attendings and the residents. So depending on your role, if you're part-time, if you're full-time, you'll typically act as an attending for the cases that are run by the residents. So people like me. You'll help them with decision-making and kind of if there's any medical emergencies, you'll help them intervene with those. They are practicing under your license oftentimes, so you just got to be aware of that. Like even though you're practicing under a hospital, and to school, a lot of the times they practice under your license as a dentist. You would participate in journal clubs and lectures that are given to the residents, and you would just teach residents about anesthesia and the different ways to run a case. It's kind of nice having a different attending for every case, because we always say anesthesia is like cooking rather than baking. There's a lot of ways to get to the end result. And if you do it one way versus the other, it's not going to mess up the recipe. So it's nice to learn different methods on how to do things in anesthesia. And you will assist in teaching dental students or residents about airway management as a resident, and some of the attendings will also teach local anesthesia or injections for dental students. Sorry, I keep losing it here. 1 second. Oh, wait. Sorry about that. Okay, so you'll go over nitrous oxide, which is something that dental students can use, and you will kind of teach dental students about general anesthesia. You'll also give them insight on private practice if you are part-time attending, or if maybe you worked in private practice before and then you are doing full-time anesthesia now. You'll kind of give them insight on some private practice models and kind of how things work. So in summary, dental anesthesia is a really great profession. It allows you to combine kind of dentistry and medicine and provide an invaluable service to dentists and patients. So just a little bit about dental anesthesiology. So following a 3-year residency program, as well as passing, oral boards and written boards, you will become a board certified dentist anesthesiologist, and you can provide a full range of anesthesia services, all the way from minimal or moderate sedation, so maybe just kind of like laughing gas and maybe a pill to make a little kid sleepy, all the way up to general anesthesia that you would get in a hospital for a big surgery. And you can do all of that in an office setting, in an ambulatory setting. I really love this specialty because, number one, I got a lot of exposure in it. In dental school, I got to see how it treated very, very vulnerable populations, primarily pediatric patients, that have really poor dentition, patients with special health care needs that are really, really frightened of the dentist and can't otherwise get dental work, and very dental phobic patients. So it kind of helps very vulnerable populations. It's a really great service to, treat these patients. And it's really very helpful as well for the providing doctors, because they can, treat these patients as well. All right. And then if anyone has any questions, I will put up my social media. So there's my Instagram and my email. If anyone has any questions like following this, you can always DM me on Instagram or email me.
Okay, thank you so much for that. That was definitely super informative. I didn't even know about this profession until tonight, actually, or until I was about to meet you. So it was really cool to hear. Yeah,
great. I'm glad you enjoyed it.
Okay, and then we do have a couple of questions. I myself too. Okay, so did you find that compared to the other residencies, or let's say the regular 1-year residency that other dentists have to go through, is it very difficult and competitive to get into? Is there a lot of spots to enter these programs?
Yeah, so I would say for anesthesia, it's competitive because there aren't many residency programs. So there are 8 in the United States, and I believe 1 in Canada, but I'm not sure how the admissions work for the 1 in Canada, so I won't speak on that. But in the United States, they accept anywhere from 2 residents per program to up to 6 at some residencies. So I believe Ohio State will accept 2, and maybe NYU, I believe, accepts around 6. Pitt accepts 4. I think Jacobi accepts 4. So there's not many spots out of dental school. Wow. So a lot of people will work for a couple of years, get a lot of experience.
I see. Mm-hmm.
Yeah, but I think personally, obviously you want to have, good grades, competitive grades, but I think experience really means a lot. And showing, that you went out of your way to shadow and extern and things like that is definitely very, very helpful.
Did you yourself take any gap years before going into residency? Or?
Yeah, I did not. I went straight through just because I
Oh.
felt like I had a lot of, prior background just from going to Pitt for dental school. Because
Mhm.
again, we had the program here. I was exposed to it a lot. However, my co-residents and then a couple other residents that have gone through the program before me have worked for a number of years. Some of them did general practice 1-year residencies. So it kind of just depends on, where your path takes you.
Okay.
But I don't think any path is the wrong one.
Hmm. Did you want to know that you wanted to do the specialty since like the beginning, or was that something that like developed, or?
Yeah, so I knew it was a specialty before coming to dental school because one of the oral surgeons in my hometown used a dentist anesthesiologist. So I was chatting actually mostly with him. It was funny during my shadowing with the oral surgeon, but I never really considered it until probably like my second or third year of dental school, where we have our special needs clinic at Pitt. And so that's where we service a lot of our patients. And so I got to kind of see the anesthesia team working with the dental team, and I just was exposed to it so much in our special needs clinic. And so I definitely think that's kind of where it stemmed from. And then I just learned more and more and really, really, really liked it. And I'm really happy that I went with this decision.
Okay, that's so cool. Okay, and then another question that we have is, do you know what the job market is like after you're done with residency? Is there like, I heard like a lot of open positions in the Midwest, but like on the coast, is it super competitive or?
Yeah, so it kind of just depends on where you're looking. So it's really nice because the DA community is pretty small. So chances are, like, you go to a program, the program director knows someone that works in Arizona, that has a practice set up in Arizona, and they might be willing to take you on as an associate and work maybe either at a surgery center or in a mobile group. It's kind of really nice because there are a lot of groups across the United States that are well established with offices. So sometimes, they want to take on more offices, but they just don't have the person to do it. So they'll hire you. And so that's really nice to be able to do that. And again, there is areas where you can just go out and start your own practice, start your own kind of mobile anesthesia practice. You just market yourself to patient populations that would need the sedation, typically pediatric dentists or oral surgeons. And things like that. But yeah, there's definitely a good job market. It grows every single year, I would say, especially because, more and more people know of dental anesthesia, even as patients. So they're more likely to go through with sedation for their dental procedures.
Okay. All right. And then let's see. Oh, what's a typical, like, how many days do they work a week? Is it like, I know some dentists work only 4 or 5 days. Is it
yeah, so it's typically the same thing. I know just like in this area, it kind of depends on, what office needs you for that day. So at least in Pittsburgh, the private practices, the pediatric dentist that they'll go to, they'll have like one day, maybe it's a Wednesday, that's like their sedation day. So you'll go in like every Wednesday and do that. So it kind of just depends on how many offices you're going to. You could always also take on more, take on less, but it kind of depends. It can be anywhere from, like 3 to 5 days a week. I know some, older DAs that are thinking of retiring soon, so they're definitely scaling back. It's pretty much Monday through Friday, but maybe on Saturdays, if, oral surgeons want, it's like easy with like high school kids to get their wisdom teeth out on, a Saturday maybe. So it kind of just depends on the treating doctor you're working with and what kind of patients they have.
Okay, yeah. And it's kind of like you build your own schedule too, I'm guessing, like deciding when and where to go. Okay.
Yeah, exactly.
Okay. And then as a resident now, how do you feel like the work balance is for like studying and like your own life? And
yeah, definitely. So I think Pitt is really nice in that regard because the entire first year we are in the dental school. So it's pretty much a like 9 to 5 job. Well, not really 9 to 5. It's more like 6:30 to 4:30 with anesthesia. But basically what happens is we kind of go in for the morning. We'll have a case in the morning, a case in the afternoon, and then maybe sometimes like 2 cases in the morning, depending if they're quick. And then we kind of just go home and, we have our weekends off and we can study on the weekends or study at night. It's kind of nice in that regard. So when we're in the hospitals, it's a little bit more demanding, but it's not really that demanding compared to other programs. So Pitt's nice because we don't have true call. So we'll never be, sitting at home with a pager and they're saying like, oh, you have to come into the hospital. It's more like you are assigned a 12-hour shift, and that might be overnight, that might be, during the day, and like while you're at the hospital, you'll be called to different places. But with Pitt and the hospital, we're mostly just, shift work, which is kind of nice in that regard. And we do some overnight shifts, but we're never truly like on call, like an oral surgery resident would be maybe like every 4 days when they first start. So it's really nice in that regard. Some, rotations that we do. So we do rotations doing anesthesia. We go through the children's emergency department where we kind of serve as like a medical resident. And then we'll go to our women's hospital. That is where we get trained in doing like epidurals for labor and delivery. And so we kind of like have like many different hats. We're not just doing anesthesia the whole time. We do a rotation in the one ICU. We go to a rotation that's advanced lung disease. So we'll treat patients with advanced lung disease. So some of those are a little bit like more relaxed in terms of the hours. A couple of other them, like the ICU, for example, is a little bit longer days and less time off because that's just like a more demanding area of the hospital. But yeah, so it kind of just depends second and third year. But I would say overall, it's like a really great residency work-life balance. At Pitt, we get 15 days off a year, so we can take those, however we want to. I know, which is nice. So yeah, that's nice. It's nice because like in dental school, we don't really have like exams or practicals or anything like that. We kind of, we do have like one, it's called an in-training exam, which just kind of, it's an exam you take every year to track your progress and your learning throughout the 3 years. And that's like our only really mandatory exam. But other than that, we don't really have like exams or practicals like you do in dental school or maybe in college. So yeah, so that's kind of why it's a little bit more lax in that area as well.
Okay. And then, so, translating that into the job itself, do you think the job itself can get pretty stressful? Because I know a lot of like anesthesiologists find that their jobs are stressful. So
yeah, I definitely think so too, especially because like a lot of the times you're on your own, kind of you're at the office, say you're at a pediatric dental office, you might have the pediatric dental assistants there and the treating doctor, but a lot of the times if you don't have an assistant, you're kind of on your own. So you gotta, do all your patients, you have to start all your patients, recover all your patients, and that can get kind of daunting. And, you are the, in terms of anesthesia, if there's not another, anesthesiologist in the room, you're the most trained in the field of anesthesia. So that comes with like a lot of responsibility, and you have to like really respect the kind of, I guess, scariness of anesthesia sometimes. So it really makes you like hyper vigilant in that regard. So it can be stressful at times, but as long as you keep patients in a safe state during, and you keep them at their baseline and monitor them very closely, anesthesia is generally very safe.
Okay, so you already like started to get some experience in that only in your first year?
Yeah, so we were thrown in like day one working on cases. So it's kind of scary, but it was nice that we had upper level residents and our attendings that were there to kind of like teach us the ropes. And like we studied a lot beforehand. And so we kind of knew like the basics, and then it was kind of just putting it into practice. But yeah, it's really nice at Pitt. We kind of are just, thrown right in. But we are in the dental school. So it's really nice that we're doing like what we would do every day, like dental anesthesia. We're not doing anesthesia for, a hip replacement or, a liver transplant or things like that. So we're doing anesthesia for dental work, which is nice to kind of get your feet wet. It's a little bit more relaxed in terms of like the surgical process. And you just get to learn really well, and you get to learn how to recover patients for the ambulatory setting, which is a lot what you'll do every day as a DA.
So in like most oral surgery practices, they'll have like a dental anesthesiologist there?
So sometimes they do. Other times, because oral surgery residencies, they do a anesthesia rotation. So they learn, how to do sedations as well. Sometimes they'll do it themselves. And they'll have, like I said, like nurses. But sometimes they'll do, maybe for more medically complex patients, or just for like a more difficult case where they think it might be, a lot of implants, or maybe it'll be hard to take out the teeth. They don't want to have to worry about doing both. Like sometimes they'll hire a DA in that regard. But yeah, it's typically oral surgeons, pediatric dentists, patients that treat special needs patients, and like really dental phobic patients.
Do you have a specific area of interest when it comes to the patients? Do you have like a favorite?
Yeah, I definitely think I like special needs a lot because it's really, really rewarding to treat those patients because, again, it's like a very vulnerable population. They can't really, help themselves in terms of, being scared of the dentists because at Pitt, it's really nice because we have our clinic, we learn a lot about, different conditions that require special healthcare needs, maybe autism spectrum disorder, Down syndrome, just to name a few. And so patients that have those conditions, they have a heightened response to things that maybe a neurotypical patient might not have. And so it's really hard for, their caretaker or their parent to take them to the dentist or even brush their teeth oftentimes. So it's really, really rewarding to treat special needs patients. I will say I never thought I would like peds, but I do like treating kids. It's kind of fun to like make anesthesia fun for them. But it is, I think peds and special needs are probably my favorite.
So for like pediatric patients, do you also like sedate them, or do you kind of just like administer the nitrous gas? Or
so a lot of pediatric dentists will administer nitrous themselves, nitrous oxide, like the laughing gas. If they're calling us in, it's probably more of like they have to do a lot of dental work, so the patient has to be fully sedated for that if they can't sit for it, or if they just kind of want to try to get it all done in one appointment as opposed to having the kid come back every single time. And especially with children, you don't want to really like traumatize them from like, you don't want them to come in for an appointment, it'd be like really long and scary and then they're fully traumatized from the dentist. So it's kind of nice to just get it all done in one appointment. They really won't remember it and they can just go on their way.
Okay. And then out of the 4 models that we saw today, which one interests you the most so far?
Yeah, so in Pittsburgh, I hope to stay around Pittsburgh. So in Pittsburgh, the most common is the mobile model where you're going to, a different office every day. I would love to like maybe open a surgery center or work at a surgery center one day because it's just kind of nice to be able to go to like one place, maybe have the same staff that you're comfortable with, that is like, trained to help you if anything goes wrong. It's easier if you want to carry an anesthesia machine, you can buy it, it can get delivered at the office and like you don't have to carry it anywhere. So it's definitely easier in that regard. But I think mobile is also valuable because you get to see a bunch of different patients and it's kind of hard to get other people, like other specialists or other dentists to leave their office and come to your office to do work. So it's kind of just easier to go to them. They're more willing to hire you, I feel like, if you can go to them. So that's also beneficial as well.
Okay. Yeah, and then would you say you have any like, what's the word? I'm thinking of like, what's the most challenging aspect or like the hardest or your least favorite part of the DA? Yeah,
I think I feel like right now for me, it's kind of just getting used to like, how to go about like working through a case if someone's blood pressure is really high, if their blood pressure is really low. But I think that all of that just comes with like experience. So a lot of my attendings, they don't get as worried about certain things because, they have more experience. They know, what to do in a certain situation. Whereas right now, I just don't have that experience. I definitely think some of the hardest thing is like starting a case, especially with pediatric patients or patients with special needs, because it's like, again, a very scary environment for them. It can be a challenge in terms of like behavior, just trying to either put the mask on their face to get them asleep. If you have to start an IV, that can be traumatic. So that's kind of very difficult. If the patient is maybe bigger than you or taller than you, can you transfer them into the dental chair type situation? So if you're on your own, that's definitely very difficult. But yeah, I would say just kind of knowing how to go about certain situations can be difficult without experience. So I feel like that'll come for me. So that's probably the scariest thing right now.
Okay. And then since your program is so small, are you friends with like all your residents? Is the environment competitive or?
Yeah, no. So like I felt like this, at my Pitt interview for dental school, and it carried on into residency as well. I just felt like everybody was truly friends with everybody. In my program, there's 4 of us in the first year, 4 second, 4 third. So there's 12 total. So we'll get together outside of residency, especially the first years, like we get together, each person kind of gets together with their own class, but then we'll get together as a big group. We have a holiday party at the end of the year. We eat lunch together every single day. So it's like really fun. It's a really family environment. My attendings are really, really great people, and they're very, very helpful. Like they're really great mentors and friends. And, I can talk to them about anything, anesthesia related or not anesthesia related. So I definitely think that family environment kind of carried over to residency from Pitt Dental.
Yeah, you're really selling me to Pitt. You know?
I know, you should check it out. Seriously.
Getting me a little excited. Yeah. Okay. And then I think that actually wraps up all the questions that we have for tonight. Thank you so much for your time and
Oh my gosh, no
such
problem.
a wonderful presentation. I thoroughly
Thank you so much. Thank you so much. It's so great that you guys are doing this, especially with COVID, because it's really, really difficult. And I've read like a few of my friends that are applying to dental school, their applications, and I think it really goes to show like if you're doing things like unique things like this to get your like shadowing hours, that's definitely something that'll stick out on your application. So it's really awesome you guys started this.
It's amazing to have you guys come and take the time to do this with us.
Yeah, thank you so much for having me.
Okay. All right. Thanks everyone for watching and have a